And tonight we're getting answers about how the state's vaccine rollout plan is going. Some reports are showing that Kansas is far behind other states in getting first doses of the vaccine out and are not expected to meet their goal of vaccinating 150,000 people in the state by the end of December. Our Capitol Bureau reporter Rebecca Chung talked to the experts about why things are moving so slowly.
We never have this problem with influenza vaccination, with pneumonia vaccination. You are trying to vaccinate a large amount of people in a very short amount of time. This is just a unique circumstance.
According to the governor's office, the state planned to receive 150,000 doses and get 150,000 Kansans their first shot by the end of December. But a New York Times report shows that Kansas is far behind in meeting this goal. Here's how the numbers break down. According to the report, the state's been allocated nearly 165,000 shots. So far, more than 114,000 of those doses have been distributed around the state. But only about 12,000 shots have actually been given out. That means only about 10% of the shots that have been distributed have been given, much lower than the state's neighbors like Missouri, which has given out about 31% of its distributed shots. Right now, Kansas is giving shots to high-risk healthcare workers and people living and working in nursing homes first. But you may see some differences county to county.
We broadened it out to all healthcare providers, and that includes in your nursing homes and your prisons and your EMTs. And every county may be doing it just a little bit differently.
The governor said the process follows the phases of priority outlined in the state's vaccine distribution plan. While things aren't moving quickly quite yet, medical experts do say they anticipate picking up speed as we move through the state's phases and it becomes available to the general public.
And once they're able to be distributed to those other places, such as pharmacies, commercial pharmacies, other small family medicine or internal medicine clinics, I think that will help improve.
In the meantime, medical experts and state officials are focused on controlling the spread of the virus through safety protocols like social distancing and practicing proper hygiene.
And as the year ends, many are looking ahead to a future without coronavirus. Reaching herd immunity would require vaccinating about 80% of the population. Vaccine rollout is underway, but some experts warn it could take several years before we reach herd immunity. It all depends on how quickly people are vaccinated.